Good afternoon, Namibia and the world, and welcome to our very first session after a very lengthy break from this particular platform. My name is Desire Shianua Kahiha, and I'm your host for this afternoon. The topic, we are looking at the danger of antimicrobial resistance, and that is for short AMR. But before we do that, I would like to humbly call on Dr. Kalumbi Shangula to give us the COVID update, and I believe this would be for the 8th of May 2022. Good afternoon, Doctor. Thank you for gracing us with your presence again.
Good afternoon, moderator. It's my pleasure. Good afternoon, panelists. Good afternoon, fellow Namibians. I present to you the COVID-19 report for the 8th of May 2022. We have received 881 results over the last 24 hours reporting cycle, and out of those results, 68 of them tested positive for COVID-19, which represent a 7.7% positivity ratio. Among them are 59 which are new, and 9 are infections. The sex distribution is 41 females, of which 35 are new cases, and 27 males, of which 24 are new cases. The age range from 2 years to 78 years. They as follow: Comas 43, all from Windhoek districts. Erongo 9, all from Swakopmund. Karas 3, all from Ruderitz. Hardap 2 from Rehoboth. Omaheke 1 from Khobabis. Zambezi 1 from Katima Muliro. About 75% of the cases, they are from Comas regions. Among the confirmed cases, we have got 6 learners from different schools, 3 healthcare workers, 2 students, and 1 teacher. 5 cases has received 1 dose of COVID-19 vaccines. 13 cases are fully vaccinated, of which 6 have received a booster dose. 3 cases are not eligible for vaccination, and 47 of them are not vaccinated. The number of active cases now stands at 929. 24 of them are currently hospitalized, of which 4 are in intensive care unit. All 24, none of the 24 cases which are hospitalized, including those in ICU, have been vaccinated. On the positive side, we have not recorded any death during the period under review. By the 8th of May 2022, a total of 458,876 people aged 18 years and older have received 1 dose of COVID-19 vaccine, which represent 31.1% of the target population, of the adult target population. A total of 139,965 have received the Johnson & Johnson vaccine, while 260,895 have received 2 doses of other vaccine type. Hence, 400,860 adults have completed their vaccinations, translating into a 27% of the target population. 20,904 children aged 12 to 17 years have received 1 dose of the Pfizer vaccine, which represents 7% of the target population. Of this, 8,072 are fully vaccinated. Hence, the cumulative number of people vaccinated with the first dose of COVID-19 vaccine for both adult and children stands at 479,780, of which 408,932 are fully vaccinated, translating into a 23% of the total target population. A number of 56,187 people have received the booster dose. In terms of summary, currently the total number of individuals who have tested for COVID-19 since the beginning of the pandemic is 159,278. The total number of recovery is 156,582, which gives us a recovery rate of 98.3%. Total number of deaths, 3,692, with 335 classified as COVID-related deaths, giving us a cumulative number of deaths of 4,027. So far, we have tested 1,013,304 samples since the beginning of the pandemic. The number currently which we still keep in the quarantine facilities stands at 215. This concludes today's COVID-19 update. I thank you.
Thank you very much, Dr. Shingula. Again, we are strongly reminded that we have hit the winter season, and this is the time during which COVID rears its ruthless teeth. So we are really expected to take care of ourselves and take care of our nation and loved ones by ensuring that we practice social distancing, we sanitize our hands frequently, and make sure that we wash them with running water and soap. Please do take care, Namibia. We do not want the onslaught that we had, especially last year. Thank you very much, Dr. Shingula, for your time. We get back to the topic this afternoon, and as we said, we're looking at the danger of antimicrobial resistance, AMR for short. I hope I pronounced it correctly. And in studio, I've got two doctors that are going to help us to understand what it is and where we stand as a country with regards to this. We have Dr. Lee Monique Anderson. She is a veterinarian with the Central Veterinary Laboratory with the Ministry of Agriculture, Water and Land Reform. Good afternoon, Doctor. Thank you for being with us. We also have Dr. Frank Bush, and he is a veterinarian with the Friedrich Loeffler Institute. Good afternoon, Doctor. Thank you for being with us.
Good afternoon. Thanks for having us. Thank you.
I'm sorry, vet. I'll stick to vet because the full word is a tongue twister for me. I'm sure we all have a few of those. With that said, let me just get to the gist of it. Dr. Bush, can you tell us what is antimicrobial resistance?
Yeah, in short, antimicrobial resistance is the ability of a microorganism to resist and grow despite the presence of a drug that was designed to kill that bacterium.
Okay. Okay, I'll get back to that one. Next question. While I'm formulating that question in my head, because now you made me very curious. In 2015, the Global Action Plan on AMR, or antimicrobial resistance, was released, followed by the development of National Action Plans, and for short NAPs, from around the globe. Namibia launched its plan in 2017. Can you please just talk to us about some of the objectives of this plan? Dr. Bush, I believe.
I think that was the question for Dr. Anderson.
Okay.
Okay, so the National Antimicrobial Action Plan, it was actually implemented based on 6 strategic objectives, which were surveillance, prevention, rational antimicrobial use, communication, collaboration. It was for training and research and development. And these objectives, they were superimposed on currently already existing policies, programs, and policies and programs that we have in place.
Yeah.
So these ones, when you look at each of these objectives individually, just shortly, we wouldn't go into them now deeply,
Yeah.
but the surveillance is just for to have like an overview of what is actually going on out there constantly,
Yeah.
to always know what is out there, to know what we're dealing with currently. When we look at prevention, we look at things like how we could prevent antimicrobial resistance. Looking at prevention, we would focus on vaccination, on biosecurity measures, on hygiene practices. And then when we look at rational antimicrobial use, these are now by the medical practitioners or the veterinarians out there, and as well as the end users.
Yeah.
When we look at the communication, awareness and collaboration, that is awareness both at the human sector and the farming sector,
Yeah.
and the collaboration between all of these sectors to make it a one health. And communication is also just what we put out there and what we're getting back from each of these sectors.
Yeah.
When we look at the education and training, we look at what basically we want to train the prescribers out there, the end users of these drugs, with the problem that we're facing. And with research and development, we look at things like how can we use what we know now and what we're learning currently to help us in the future, what resistance we're having currently, and what we will do about it in the future, or how we could curb this, or do research into finding new ways, new means, new drugs. That's basically
In a nutshell.
the objectives.
Okay. Dr. Bush, we come back to you, and based on the expected objectives and plans of the Global Action Plan, the Ministry of Agriculture, Water and Land Reform and other key stakeholders hosted a stakeholder workshop on antimicrobial resistance. Who are these stakeholders and what are their various roles as stakeholders in ensuring that the objectives of these plans are achieved?
Yeah, thanks for the question. So anyone working on AMR in Namibia is a stakeholder of relevance to us. So that could be, as my colleague Dr. Anderson has said, that could be colleagues that do research and development, looking for new drugs to actually make sure that we have antibiotics that will definitely work, because as I have said during my first question, these bacteria will constantly find strategies to make sure that the newer antibiotics will not work. So for research and development, it's really important. So we have the Namibia Medicines Regulatory Authority, for example, in Namibia, that keeps an eye on the drugs that are being prescribed by medical practitioners, but also by veterinary practitioners. We also have, let's say, the Central Veterinary Laboratory that plays a central role. It's just about to establish AMR surveillance on the veterinary side. Then, of course, the Ministry of Health as well. They have a number of work streams where they look into antimicrobial resistance and strategies to combat that. And based on the guidelines that already exist by the World Health Organization, by the World Organization for Animal Health, the OIE, and also by the Food and Agricultural Organization, the FAO. So anyone in Namibia working on AMR was a potential stakeholder for us and was invited to the workshop and to the stakeholder meeting. And you may remember the last workshop was held in March 2020. Again, a lot of these stakeholders came together, and my colleague will talk about this later on. A number of strategies developed, but because of COVID-19, unfortunately, not much has happened in the meantime. And this stakeholder meeting and workshop was instigated to start again where we left off around about 2 years ago.
So have you had any recent, even if it's mini workshops, to try and get the ball rolling again, not necessarily at a large scale like the last one in 2020, but to just try and make sure that each, little circle starts doing something?
Yeah. Yeah. Okay.
Okay, so yeah, like we said, the last workshop that we had was in 2020, which was quite a while ago.
Yeah.
And that was because of the COVID pandemic. Yeah. So it was a 2-year gap, and we recently had a workshop just now in April this year. Mm-hmm. And that was, we basically orientated our workshop this year on the resolutions from the workshop that was held in 2020, okay, just to pick up again and to see where we are picking it up from. Mm-hmm. And at the same time, we were also using the opportunity to connect and to reconnect all the stakeholders again, and also to review the current AMR situation in the country and the status of the implementation of the Namibian Antimicrobial Action Plan. And then also we just used it again as a platform for awareness creation.
Yeah, okay. Staying with you, Dr. Anderson, could you help break down the resistance of this in relations to its danger to both human and animals?
Okay, so when we look at antimicrobial resistance, basically, so we're sitting with a problem. We have microbes that they found a means to curb or to run away from what we are trying to do. Yeah. So our drugs are not working how they are supposed to be working. Yeah. And then the end result will basically be that we will fail to successfully treat illnesses and diseases, which would also lead to prolonged and more severe illnesses, and also increase the deaths in both humans and animals, and at the same time production losses in the animals, and then it will have an impact on the food safety. When you look at the food safety, you would think about it in this way that say the veterinarian doesn't use the drugs correctly, resistance build up in the animals. Yeah. These animals are ultimately going for food production, so they're being consumed by animals in some way. These microbes are then carried over from the animal to the humans, which also then have a result on the humans. So the dangers are on all the sides. Okay. Just coming together.
Yeah. As they say, it's a food chain.
Yes.
So we have links everywhere. So I guess that is understandable how that could be carried around. Can you also explain to us the antimicrobial usage in Namibia and what some of the unsafe traits or behaviors observed from both vets and human doctors are?
I can give you an example. So antimicrobial use, for example, in the veterinary profession, let's say you have a farmer that has a cow with infection in its udder, mastitis as we call it. So the question is, as I said, according to guidelines, the best practice would be to call your veterinary surgeon. He would attend to the animal, he would take samples, and he would then, through laboratory checks, come back. He would ask the laboratory to do an antibiogram. That basically means we have identified certain kind of bacteria in that infection that are causing the infection. And now, through the antibiogram, we know which antibiotic will actually potentially kill these bacteria. So on that basis, the vet would come back to the farmer and said, yeah, we've done all the necessary tests. Here is the medication, here's the antibiotic XYZ. Please treat the animal for 5 or 7 days or whatever the treatment asks you to undertake. So now I'm coming to the pitfalls of that. So if you have an antibiotic that needs to be prescribed for 5 days, it means the farmer has to use it for 5 days and not for 3 days or 2 days. It needs to be for 5 days to make sure that all the bacteria in the body of the animal causing the mastitis in this example will be completely annihilated. Another problem would be, let's say, to use antibiotics that will not be working on a particular infection. And so if the farmer says, oh, last year I used for this certain infection and antibiotic so-and-so, he might go back to that bottle of antibiotic that he had from last year, and he'll check it again and realize it just doesn't work, because meanwhile there are different bacteria that have caused the infection.
Yeah.
And then the other problem is, and it was already raised by my colleague Dr. Anderson, that antibiotics, the use of antibiotics should be overseen by a medical professional or by a veterinary professional. There are in Namibia antibiotics that can be purchased over the counter without a prescription. And that again is a problem, because these antibiotics have been used for many, many years and are not effective anymore. They are frequently what we call broadband antibiotics. They cover a wide range of infections, but of course every infection needs a medical or veterinary assessment to make sure that we can not create new resistance, but that we have always the correct antibiotic to use for a certain infection.
Okay, okay. Well understood. I think some of the elements I've actually learned right now. I didn't know some of these things. I'll be very honest. So I'm glad I could actually be the one to tackle this topic, so that I could actually have the opportunity to learn the same way that we are creating a platform for everybody else to be well informed and educated. As I always say, this is a platform that we can use broadly to try and help each other learn a few things. And sometimes we also need you as our viewers to teach us a few things, or even ask your questions that could teach the next person through the answers that come through. So with that, we would like to invite you to give us a call in studio. The number here is 061 400 397. 061 is the area code, 400-397. You can also drop us your comments on our social media platforms through which we are live streaming as we speak. On Facebook, we are at the Ministry of Information and Communication Technology, Republic of Namibia, Ministry of Information and Communication Technology, Republic of Namibia. You can also find us on our YouTube platform, and our handle there is MICT Namibia, MICT Namibia. You can find us on YouTube. Continuing with the questions while we wait for your comments and contributions to the program, I'd like to find out what are the best practices that were recommended by the stakeholders from your workshops regarding the usage of antimicrobials?
I'll happy to tackle that question. So really, I've referred to international guidelines that exist, developed a long time ago by the WHO, the World Health Organization, and also by the World Organization for Animal Health, the OIE, and the Food and Agricultural Organization, the FAO. So we didn't have to think about new guidelines. They've been there for many years, and in many places they have been observed. But of course, it's important for every country to assess the situation. How well does the prescribing of antibiotics work in the country? How strong is the regulatory authority that will let's say, look into drugs that are not licensed for specific use, antibiotics that are not licensed. So there are a number of things that need to be looked at. And one of the main issues identified were the use of antibiotics that can be obtained without prescription. So we have discussed with our stakeholders, especially with the Namibian Medicines Regulatory Council, that these antibiotics that you can freely get over the counter, they ought to be upscheduled. That means that you can in the future hopefully only get it through a prescription by a veterinary professional or medical professional.
Okay, okay. No, that sounds actually understandable, especially with from what I'm understanding, with every new year, for example, there's a how do you call it? An evolution with regards to how microbes react and respond. So that way we also need to evolve in the way that we approach these particular issues. I believe we've got a social media comment. And this one comes from Richard Kambanda. And Richard wants to find out, one of our Maheu commercial beverages contains... Richard, you're testing my science language here. Contains Netamycin. Thank you, Dr. Bush. Contains netamycin. I've Googled that. Supposedly, netamycin is widely found in the food industry within fermented foods such as cheese, local brews, and even pastries. Is netamycin safe at such low doses? Is netamycin approved for human consumption within Namibia? I think that's a good question. I'd also like to know.
It's a good question.
What is netamycin anyway?
Well, by the name mycin, it would give an indication it could well be an antibiotic.
Okay.
I don't know, Dr. Anderson, if you have an answer to that particular question. It's a food safety question, so I'm not necessarily convinced that we are the right people to tackle that question. But it's a great question, and Food Safety Authority would be the
right
correct
person.
authority to answer that question.
Okay. Sorry about that, Richard, but I think because now you have also triggered my curiosity, we would most likely, or hopefully our research team will help us out by forwarding this question to the proper authorities, and hopefully they will be able to promptly give us a response that could actually help us understand what you were asking, and as I said, educate us further. There's another question again from Richard. Any update on the avian flu outbreak that occurred in the Erongo region? Please, why did the fish die at the end of the past rainy season? What could have caused that?
So we're moving slightly from AMR into avian influenza. I'll make a start with that. I can't answer the second part of the question, Richard, but I assume you're referring to the avian influenza outbreak in Cape Cormorants that was along the coast between Swakopmund and Walvis Bay. What I can tell you is it was a viral infection, serotype H5N1. As far as I know, that was the first type of H5N1 we have seen in Namibia. Avian influenza comes in a number of serotypes. Some of them are highly pathogenic to humans as well. So there's always the risk of transference of infection from, let's say, a member of the public who's found a carcass and wants to take it to the veterinary practice for disposal, something like that. If potentially that can backfire, you need to take precautions and make sure that you ring the veterinary services and let them investigate and dispose of that carcass. So the relevance to the fish dying at the end of the past rainy season, I'm sorry, Richard, I can't answer that. But you will probably see on the various websites, H5N1 occurrences are global occurrences because of the migration of wild birds, and the main problem, I suppose, for the Directorate of Veterinary Services here in Namibia is to keep any infection from wild birds away from commercial birds here in Namibia.
Okay. Hopefully, Richard, we at least assisted you with the first part of that question. And as Dr. Bush is saying, unfortunately, they can't exactly help you with the second part. So we will dig on, we'll read on, and hopefully we could come back to you with a response. Getting back to the issue of the workshop, Dr. Anderson, what are the opportunities that come up or that arise through collaborating and networking beyond sector-specific boundaries in controlling AMR efficiently?
I think that question was also directed to Dr. Frank.
Okay.
Sorry, could you just briefly rephrase?
The question is basically, what are the opportunities that arise in collaborating and networking beyond sector-specific boundaries in the aim to try and control AMR efficiently?
Yeah, it's an excellent question, because when we were first thought about putting the stakeholder meeting and workshop together, we were initially thinking about One Health. The One Health concept, which basically means you need the involvement of the environment to see what's happening in the environment. You need to have a look and see what's happening in the public health sector. And you also need to have a look and see what's happening in the veterinary sector. So I'm coming from the Federal Research Institute of Animal Health. And within that, we have an Institute for Animal Health, International Animal Health, and One Health. So we first approached that. And then, as I said earlier, we realized that apart from the 3 ministries I mentioned, we have many more stakeholders. That includes, of course, as Dr. Anderson said, the end users, the farmers, the retailers, pharmacists, and so on. So the beauty of tapping into all that knowledge from all the various institutions and organizations that came together was that they have specific agenda items that they have worked on. For example, research and development. Now, not everyone will be cited about what's happening in research development. That is frequently undertaken by universities. So it was important and really useful for all of us to learn what's happening, let's say, on research and development. Then we talked about education and awareness. Awareness raising is also what we do today, and I'm really pleased that you've set up this program today. And we concluded that it is everyone's responsibility to raise awareness in their own sector. Initially, we were thinking, okay, One Health, you've got the 3 ministries, Ministry of Education, Ministry of Environment, Ministry of Agriculture, Ministry of Health. Put them together and maybe think about a national TV awareness campaign. That will be one step, but it doesn't preclude other organizations, institutions that work on AMR to say, we do this for our own sector. For example, if I think of the veterinary sector, the first thing comes to mind is maybe the responsibility of retailers, if they are giving antibiotics, over-the-counter antibiotics, that they also talk to the farmers about the risks of that. Equally, it's a responsibility of a veterinary surgeon to go to his client and say, okay, here's an antibiotic, here are the instructions, and please adhere to the instructions for that and that reason. So I think every sector can do its own education and awareness raising, but of course the beauty is we can all come together and do it together. That would be another option.
Okay, that's a good one. I like the fact that you said that individually as sectors, you're not bound or restricted from creating the awareness, but collectively, campaigns can actually be set up, and I think that would speak volumes, because then you also have shared resources that would enable bigger campaigns to take place. As we know, everything needs money. We all know that. Dr. Anderson, I would like to find out from you, like Namibia as a country, what is one of the biggest issue, or I don't even know how to put this one. Which microbial or issue have you had the most or struggled the most within the country as vets?
Okay. In the veterinary section, I think a lot of the vets would agree that the specific drugs that we're struggling with are the ones that we just spoke about earlier, which are readily available over the counter without prescription. And these antibiotics are the ones like tetracyclines, sulfonamides, that the farmers, they can just go to any retailer, they can just buy it without having to see a vet or a vet seeing the animals and what it's for. So those are basically the top ones, but we are not just focusing on that, because somewhere we could also have some other resistance that we haven't picked up yet. So we are trying to motivate everyone to see where we are standing currently, because we have this mentality that tetracyclines is now the problem, but is it really the only problem that we're having? So yeah, I would say those ones are the ones that we're really struggling with, the ones that the farmers just use and that they keep for such a long time and use however they would like to use it. As for the human sector, I wouldn't be able to say.
Dr. Bush, building on what Dr. Anderson just said right now, she mentioned farmers keeping some medication for a long time. Could that also be one of the factors that, how, can that actually be one of a problematic factor?
It definitely can be. So it's not only that you need to adhere to the expiry date, because these antibiotics have a definite expiry date, but also how you keep the antibiotics. You will remember from some medication that you have received from your own doctor, it does say, store in the refrigerator or store between 18 and 20 degrees or whatever the recommendations from the manufacturers are. So storing the medication safely, that the medication or the antibiotics can't be used or abused, and also adhering not only to the exact dosage, let's say like 2 milliliters per kilogram of animal weight, for example, and also, as we said, some of these antibiotics have a shelf life of a year maybe, or sometimes even less. That needs to be taken into consideration. If you then use an antibiotic, it will not work.
Okay. So please, our animals also need to be taken care of. The same way that as a human being, you would not want to consume anything that has gone beyond its expiry date. It's the same way that we should treat our animals when it comes to their medication. Today's topic was one that is very rare, but highly informative. As a country, we depend a lot on our agricultural sector. So it is very much one of those topics that we now have to make an effort in making sure that we create awareness. We read up on it, we educate ourselves, and where we do not have answers, we do approach our veterinarian services, whether in the private sector or in the public sector, to just try and teach ourselves about these different elements and how it is that we can do our part to curb the problems that arise, because we do not want to have food shortages or economical issues because of something that we could have prevented. I would like to thank our panelists for making the time to come and discuss this topic with us, and please, our platform, as we always say, is an open platform for educating our Namibian people. So hopefully somewhere in the future, we could have you back. We would love to have you back on our platform to continue with this particular topic again. With that said, myself, Shianua Desire Kahiha, and my production crew, we would like to thank you for partaking in our session this afternoon. See you on Wednesday. Bye-bye.